This is Comcast Newsmakers.
Imagine how much your life would change if you sustained an eye injury. Hello and thanks for joining us. I'm Jill Horner. This hour's newsmaker is Dr. Robert Scharfman, Vice President of the New Jersey Academy of Ophthalmology. And today we're talking about eye injury prevention and summer eye safety. Thanks for being with us, Dr. Scharfman.
Thank you.
This is an important thing to talk about during the month of July because July is Eye Safety Prevention Month. So tell us a little bit about what that means and what we need to be aware of.
Well, July is also a month where people are using a lot of fireworks, and fireworks create a lot of injuries. Each year around July there's 5,700 fireworks-related injury, and over 1,000 of them will cause eye injuries. And of those 1,000, 250 people are going to lose some permanent vision, and 20 people are going to lose their eyes from fireworks.
So this is something not to take lightly. People often shoot off fireworks in their own backyards, bottle caps, things like that, but what do we need to know when we are using them?
Well, first of all, the most dangerous firework is actually the bottle rocket. People don't realize that. They think that they're harmless, but in fact, they're very unpredictable. They tend to go off right away, and people also put them in bottles, and if they explode in the bottle will send out pieces like shrapnel into the eye. Also, things people don't realize are that sparklers are very dangerous. In fact, they're the most common cause of injury in children because children don't realize just how dangerous they are. They're quite hot. They burn around 1,500 degrees Fahrenheit, which is hot enough to melt gold, as hot as a blowtorch. And if any of those little sparkles get in your eye, the results are devastating.
Let's talk about some other things we do during the summer. One is play sports. What do we need to know?
Well, there are certainly a lot of eye injuries from racket sports and baseball and football, and there are excellent protective eyewear that you can use. If you go to the stores and you buy protective eyewear, you want to look for something that says PECC, which is the Protective Eyewear Council logo, and that means that it's polycarbonate and it's safe for sports. Other things you got to watch out for over the summer is obviously yard work. Lots of people use lawn mowers and hedge trimmers and the like, and those things send matter flying all over the place. And if you get a projectile in your eye, it can be devastating.
So many of us don't think about that. We just go out and do our yard work. I was trimming hedges last weekend, but should I be wearing goggles at all times?
Absolutely. There are goggles designed for this. They conform to what's called the ANSI Z87 standard. And if you go to a hardware store or even an eyeglass store, you want to look for a goggle that has Z87 written on it or on the package, because then you know that it's polycarbonate and it's designed for that type of use.
Let's talk about something that's become very popular in the last few years, and that's paintball. Is that a dangerous thing for our eyes, and what do we need to be aware of?
Well, paintball is very dangerous. The paintball leaves the muzzle of that gun at about 200 miles an hour, and because of the size of the paintball, it can actually impact on the eye. The orbit, your eyebrow, is designed to prevent injuries, but the paintball, because it's round, can actually get in there and impact on the eye. Almost all paintball injuries result in blindness. You definitely have to wear paintball goggles. And unfortunately, people still get accidents with paintball because they take their goggles off.
Many of us are cleaning out our houses after the long winter months. What do we need to be aware of regarding household chemicals?
Oh, lots of cleaners can splash up in your eye, and they're very dangerous. And it's very important to know that if you get a chemical in your eye, the most important thing you need to do is immediately wash the eye out with tap water. Don't delay. The longer you let those chemicals sit in the eye, the more damage they can do. Don't do any acid-base chemistry. Just get it out of your eye.
Let's talk about what we need to know if we do sustain an eye injury. You mentioned with chemicals, wash the eye out immediately with tap water. But what if we have a projectile injury?
Do you want to do the exact opposite thing? A projectile injury, you don't want to touch the eye. You can sustain serious damage which initially will not seem to have affected your eye. You must see an MD. Either go immediately to the emergency room or go to an ophthalmologist. Again, ophthalmologists are MDs. They're medical doctors. They go to medical school. They've done 4 years of medical and surgical training.
Bottom line, don't take your sight for granted.
No, not at all.
All right, thanks so much.
Thank you.
And thanks for watching. This hour's newsmaker has been Dr. Robert Scharfman, Vice President of the New Jersey Academy of Ophthalmology. I'm Jill Horner for Comcast Newsmakers.